Hello, I'm Deirdre Armstrong, the Director of Partner Engagement at the Bob Woodruff Foundation. I'm filling in for my colleague Emily Bader today. She was pulled away on some family business. Thank you so much to everyone on the call for taking time out of your really busy schedules to join us. I'm really excited to learn more about program evaluation from our expert panelists. For those of you less familiar, the Bob Woodruff Foundation's Got Your Six network is the largest non-governmental network of organizations serving our military and veteran community. The network includes over 375 veteran serving organizations of varying sizes, maturity, and focus areas. I'm confident that this content today will be helpful for our partners who are boots on the ground, serving that community every day. Diving into today's topic of program evaluation. Whether you're working in direct service, policy, philanthropy, or research, that ability to critically assess your programs can be the difference between just doing the work and doing it well and sustainably. It's key to assess, improve, and ultimately be able to talk about your impact, that storytelling piece. With that, I'm excited to introduce our first speaker to share more about the work that the Institute for Veterans and Military Families, also known as IVMF, does in supporting organizations seeking to improve their programming efforts. Gilly Cantor, Director of Evaluation and Capacity Building. Gilly, I'll let you take it from here.
Thank you, Deirdre, and thank you. I'm so grateful to be here to present on one of my absolute favorite topics, which is really about getting started with program evaluation. I have been at the IBMF for 9 years and in a variety of roles, but in all of them, I've been able to work alongside organizations, including our own, to work on program evaluation efforts, whether from getting started all the way to more formal evaluation efforts. And we've learned a lot over the years doing this work. And a lot of that comes back to supporting a really wide variety of program types with different levels of support for all of those different aspects of evaluation. So what I'm about to share is really coming from, over a decade of expertise, not just my own, but from the team here, and some lessons that we've learned with our own programs as well as programs from other VSOs and organizations. So just to jump in, I think one thing that comes up a lot, even though it might seem intuitive to undertake evaluation, is kind of like, why is it important, or is it really important, or why am I really doing this, or what is my goal? And in our experience, we've seen a lot of times where a grant or some funding is tied to a specific set of measures and outcomes, and so it's genuinely required to meet those specific guidelines. At the same time, there's lots of times where really some of the best partnerships might not have those requirements, but then someone might reach out to you and say, well, like, do you have this number? Or like, how is this thing going with your program? And so even if it's not formally required, often there's a soft requirement or an unstated ask that's going to come where people are going to ask you those questions and say, what's going on? Like, what are the outcomes that you're seeing? And you're going to want to be able to answer those questions because of the next two reasons, one of which is that it's going to tell you what's actually working with your effort. How are the different aspects of your program going? What are the short-term things that you're seeing? What are the longer-term impacts that you're seeing? All of those things help you understand whether you need to make improvements, and look at things in a more holistic way. And then relatedly, if you see what is working, you're also going to see what's working less well or what might not be working at all, maybe where you made some faulty assumptions about your program, which is totally normal, and then allows you to adjust course. And so I think that's one of the reasons why we also advocate for, as important as outcomes are, looking at things all along the trajectory of a program, which I'll talk about. One other thing I would like to add at this moment in time for our space is that the funding environment is as restrictive as it's ever been, and so there's more of a case than ever to be really tight on what the purpose of your program is, what you're doing, why you're doing it, and then what the results of it are. Because funders are going to want to see those things, and you want to be demonstrate that you're a good investment and that you're collecting that data and measuring your results. So one of the terms that gets used sometimes is this word evaluability. And really, it's kind of about readiness for evaluation. So this is really applicable if you're, evaluating your own programs and just getting started, all the way to thinking about more mature evaluation efforts. And so on the left side, there's some definitions that come from public sources, a lot of the agencies that are doing this type of work. But really, the fundamental question is, how ready is your program to be evaluated by someone, again, whether that's internally or by an external independent evaluator? We would not, I would say, recommend working with an external evaluator necessarily right off the bat. You want to understand your work, but if you need help, that might be a good way to bring someone in early to help. So really, the first question you should be asking yourself to determine whether your program is evaluation ready is whether you have looked at the research and evidence and aligned your program with those things. So what do I mean by that? If you are a housing program, for example, you're going to want to see, look at the type of housing services that you're providing, look at the literature, look at other programs, see what are the results you would expect to see for a program like yours. I know that a lot of programs have unique aspects to them, but this can at least guide you toward the right types of outcomes and measures that you should be looking for. And then the next thing you have to ask yourself is, do we have the data to measure those outcomes? Are we collecting the right things? Do we have the infrastructure internally to start collecting that information? And then lastly, once you have the information, are you prepared to do something with the information? Data is an asset, and you should treat it that way. It is as important as, not as important as people. I think people are more important, but it should be valued the way that you value your other physical assets or your time or things like that at your organization, because it's time that your staff spent collecting the data, your program participants spent providing that data to your staff. And so really, if it's not something that you are going to look at and use, it's not, you should minimize what you're trying to collect, really, so that you can focus on the smallest number of things to derive meaning from those things and make changes to your programs. So that's kind of how we've approached these questions when working with other organizations and even internally. Some of our own programs, I would say we followed a trajectory of looking at the IBMS programs through internal measurement and evaluation, which is what I started doing for us for one of our efforts. And we didn't work with external research and evaluation experts until upwards sometimes of 5 years into those programs in our own internal evaluation, because that's when we felt we were evaluation ready. At the same time, we've worked with programs that are just getting off the ground, and they want help thinking about things like the purpose of their programs and that program theory and logic model stuff. So you really can approach it multiple ways, but these questions are still really fundamental. So now I want to talk about what does that mean in practice. So this is why it can be helpful sometimes to bring in an expert, but you don't necessarily need to if you have the right folks on your team to really think about these things. So the reason why I wanted to talk about this again is because it's actually can be harder than you think to answer these questions. So for example, have you clearly defined what your program is trying to achieve? It actually is really hard. It can be really hard to do that. And one of the ways that we try to think about that is asking, what will look different if our program is successful? What will be true? What is the end state if we are able to provide this particular type of housing? We're providing supportive housing, temporary supportive housing. What is a result we would expect to see if someone is successfully housed? What is our piece of that housing puzzle that we think we're really achieving with our program? That's a question that you would have to be able to answer. Another is to ask if you have enough process documentation to identify your opportunities to capture data. So what does that mean? So for example, do you have an application? Is there a form that somebody fills out at the outset of your program? That is a data capture opportunity, but you have to kind of know what you're asking, not necessarily be changing the form every 5 minutes, or if you're changing the form, making sure that you're still collecting the same core things that you need to be collecting over time. That's like one example. Another is knowing how, what are the touch points with a client in your program? Are you reaching back out to them after a certain number of weeks or months where that might be an opportunity to capture more data? Those are the types of things that you really have to handle on, like, how does my program operate and what is that process? And then lastly, and this one is so deeply important, it really should probably be first, is there a real commitment at the leadership level, really all the way on down to measurement and evaluation? You can only really embed this type of culture if you have that type of buy-in where people are willing to take the time to look at that data and use it and put it into practice and not just use it to point to and say, yes, we're doing X. Like, what does that mean? Are we trying to improve? It has to really become part of the culture of your program. So this is relatedly my other favorite thing that I think we've tried to think through over the years doing this, especially internally. Everyone really does have a role in getting program evaluation off the ground and sustaining it and making sure that it's part of the culture. So as I said, leadership is really ultimately responsible for, I would say, two major things. One is supporting that environment in the ways that I described, but secondly, they are responsible for making sure that across an organization, the whole organization or enterprise, everyone can articulate and align on like what the purpose of your program is. So once you have defined what it is, does everyone agree? You want to make sure that the way that your comms team and your program team talk about the program is the same. They might emphasize different parts of it depending on who they're talking to, but that core mission of the program and the purpose really needs to be the same, the way that people talk about it. Then the program is obviously fundamental to the process because they're the ones that have to embed the data collection into their processes. They have to collaborate with whoever's doing the actual analysis, make sure that everything's being that the decisions about what you're measuring make sense for what the program is doing or for like what they see day to day. Like they're your boots on the ground. Then you have your external facing folks, and in addition to your comms team, that does include people who are out there doing fundraising and describing what you do. We've worked with a lot of clients that have felt a lot of pressure based on funder requirements to shift what their program. They'll make these tiny changes that over time really actually make your program shift, and it's a little bit sometimes of the tail wagging the dog. And I hesitate to say that because I don't think that the Bob Woodruff Foundation is one of those types of funders. They are really flexible, but you all know, like, there are funders out there that they ask for something and the constricted environment makes you want to bend over backwards, but it's really hard to stay true to that program purpose. And it's why that leadership element is also really important, and why being on the same page with your external facing folks is so important. And then lastly, obviously, evaluators. They're not solely responsible for all of these things. Sometimes they're supportive, sometimes they're collaborating, sometimes they're just advising. And then really when it comes to the actual like doing the analysis and helping you make meaning of the findings and embedding all those things, that's their fundamental role. But they really, in our experience, when they're treated like a partner and true collaborator is when we've seen this be the most successful. So This is another thing that over the years I feel like comes from a lot of the lessons that we've learned with ourselves and our clients and partners. So it is possible, like anywhere that you're starting is okay, and starting to measure something is better than, not trying to formalize anything. We've talked to a lot of folks where um, I think the organization feels initially self-conscious that they're, not doing a lot of surveys, or maybe they tried a survey once and it sort of didn't give them what they wanted. That's okay. I think people have smaller programs and they just spend a lot of time talking to their participants, and they have a really good pulse on the program. And so even that's a form of measurement, right? But it's also not necessarily a reason to, give up and not try something else, or to begin to formalize in some way. And that's really where and why we look at opportunities for data capture, and why thinking about those things can be important just to get started. And then relatedly, we look at evaluation as an ongoing process. It's not like, oh, let me just collect this before, let me collect this after, here's the change, here you go. Like some people, that is really what they want, and that's okay. But it works really well when it's sort of tied with a bit of almost like quality improvement and continuous improvement, and looking at those chances along the way of your program to make incremental change. And then also, once you're starting, if you're just starting out and all you can do is collect outputs, that's still like, that is a good starting point, and I think that's okay. What I've often said is that if you know your program purpose and what the outcomes are that you should expect, you should always be inching yourself toward the collection of those outcomes. It does not mean that you need to be collecting those outcomes today. You can take away my like program evaluation license for saying that, but I think if you are always incrementally moving toward outcome data collection, I don't think it's reasonable to expect a very small program that serves a small number of folks and doesn't have a lot of funds to support this effort to just automatically be starting out collecting like really perfect outcome measures. That's just not feasible for many. The goal is to know what those outcomes are, and again, like work towards collecting that over time. And then lastly, I mentioned this on the previous slide about evaluators being partners, but like really, if you are working with an external evaluator or even someone on your own team that is making you feel like you're being monitored, that's not the right relationship that I would say is like a healthy evaluator program like relationship. I think sometimes there's just a perception and then people fall into those roles, but realistically, the best way this works is when evaluators are the partner to your program and they're there to help you. And it's a really vulnerable situation as the program or the organization to let someone in, to see all the mess underneath the hood. Like I say it's like letting someone in your house when you haven't cleaned your house. So you're really like showing the good and the bad, but it's not, a good evaluator is going to treat that with a lot of like respect and trust that vulnerability of saying, I want to get better and I want to know how I'm doing and I'm trying to help people and help people better. How can I do that? That's really why they're there. That's why we do what we do. Okay, so finding that right evaluator. So these are the things that I would say if someone was coming to us and wanted help, like here's what would make a good ask, or if you're looking to hire someone or upskill someone to do this work internally, these are the things that we have noticed or try to think about. So the best is clarifying what you need and what you want. So even if you are like, sometimes that can just mean like, I don't even know what I need. I just know this is a thing I should be doing. That's okay. That's okay too. And then that's going to tell you, I need an evaluator that's really comfortable at the earliest stages and wants to be a partner and wants to help me build capacity on my team and like think about these questions, versus a very like large scale firm that's going to come in and do like an independent evaluation one time to try to publish and like validate your stuff. There's such a wide range. But you want to clarify where you are in your evaluation journey. And if you're not sure, that's okay to say too. And then once you sort of think that through, depending on the size of your team, the capacity of it, you can do a couple of things. So one is there's a lot of free resources or in-kind resources. I've often referred people to Rand's logic model tool. There are a lot of free resources out there that are pretty useful if you're willing to like go through the exercise and do them. At the same time, they can be hard to do on your own. If you've never done something like that before, it can help to have someone alongside just like the first time that you're trying to do a logic model or like go through a theory of change, like purpose exercise. So a lot of times we also recommend working with, local universities or a university partner, and they don't necessarily have to be, like veteran cultural competency is a bonus in those situations, but sometimes there are opportunities to help like increase that type of understanding amongst students, which can be really rewarding in our experience. But finding those programs or a faculty member somewhere that really wants their students to get hands-on training, that can be really useful for them and for you, and provide just enough support at either low or no cost to get you started. And then at the same time, if you have someone on your team, I feel like everyone has had this at some point where there's just the data person, whether that's their training, whether that's their actual job, maybe they're the person that has to do grant reports, maybe they're just the program person that likes Excel the best. I've seen that so many times. I mean, that was me at some point in my life. You can help build the capacity. It might be really inexpensive if that person loves doing that, to just let that person take a few courses. There's ways to upskill your own team if that's a capacity you want to bring in-house. And then if through all that, if you're just like, I need more help, you can hire the right person at the right time. Another thing we've done is if people don't have funding to work with us, for example, right away, we will help with grant writing so that it would be, I won't put anyone on the spot from Bob Woodruff Foundation, but I would anticipate that a grant application would be more competitive if there was a portion in the application that spoke to, and we have a plan to evaluate this with this partner in this way, and it would use this much money to, we would use this much of our budget to work with an evaluator to help us make sure that we're having an impact. So we will work with people to build that in, because it benefits everyone in the long run to be able to do this work in a funded way. But even if you don't have it, there are options, is really what I wanted to convey here. And then this is really my ending thing. I think we've talked about this a lot at the IBMF, and it's always a work in progress for us and for other organizations. And I said earlier, like, data is an asset, and really for us, it's like data points are people, right? So you need to really commit to this type of culture around data, we think, to be successful in the long term, and kind of give your participants and the people that we serve like the respect that they deserve, and to make good use of your resources to run your programs. And so that really means, from the honesty side, like being transparent about what's working and what's not working inside of that culture. And when you see something wrong, like, demonstrate what you're doing to say, yes, we observed. I think people like to hear, we saw this thing wasn't working, and here's what we did to address the thing. It makes you more credible and more trustworthy, and it's basically proof that you're measuring what you say you're measuring. And then on the creative side, this is especially helpful if you're just getting started. Using stories, using anecdotes can really help tell the story, especially if you're not doing heavy surveys. But the key is really trying to make sure that you're showing all the sides of things, and picking stories that are representative as you can of what a typical outcome is that you're seeing from your program, or a typical story. And then lastly, I really think it can be helpful as a person who's been both on the data producing and data consuming side of this. I I have found it extremely valuable to work with other people on reports and data visualizations to make sure that they make sense, that they're going to be useful, that they're digestible, all of those things. Like seek feedback on that and build enough time when you're doing that writing and that analysis to do that because it makes for a better product in the end. And then lastly, like as I said, data can be, you as if anyone's if on here, assuming you've been in Excel at some point in your lives, it's numbers, it's like columns, it's rows, it's pivot tables, it's code if you're fancy, right? So those numbers are people. When you're dividing people into buckets, like those are people. So it can be really important to not just keep that at front of mind, but it's also why it's so helpful as an evaluator to really treat your role as a partnership so that you get to observe the programs that you're supporting and work with the staff and talk to people. We always try to do site visits for our projects where we can, or sit and interview staff or past participants. It's really, really important. And then lastly, there's a lot of this in the broader like academic research space now that's helpful too, but it's the same with evaluation. Sometimes there's limitations on what you can share because you're doing that work for a client or you don't want to show everyone your, dirty laundry in your house. But to the extent that you're able to share that data so that other people can learn from what you did and what worked and what didn't work has so much value to others, and it can help lift up the whole space to say like, well, we tried that with our program and here's what we found worked, or we did that and that absolutely did not work, so don't maybe avoid that one. So those are the types of things that we try to think about when sharing is feasible. Thank you again so much for the opportunity to talk about getting started with evaluation.
I'd like to recognize Tremesia Gardner, Executive Director of Swords to Plowshares, to jump in here and offer her insights running a large nonprofit in the San Francisco area. Hi, Tremesia.
Hello. Good afternoon, everyone. I'm Tremesia Garner. I'm the Executive Director at Swords, as Deirdre mentioned. We are a nonprofit in San Francisco that serves veterans here in the Bay Area, and we do quite a bit of service delivery, wraparound care for veterans here, based primarily in San Francisco and Oakland. And so I could talk a little bit about what we do here at Swords. We typically provide drop-in services in both San Francisco and Oakland, homeless prevention and housing placement services, legal services, employment and training, supportive housing programs, and policy and community education. So the program that I'm actually talking about in reference to the work that Gilly just kind of talked through is a pilot program that we've started in our permanent supportive housing, which is really looking at how to keep veterans who are older adults and folks with high acuity or complex care needs, the ability to sustain their housing. So this came out of just us having some issues around noticing who we were having to evict from housing and why, and trying to figure out how to wrap services around those folks in a way that would sustain housing. And a large percentage of the folks that we are serving clearly are folks who have been homeless and also are seniors. So some of the barriers that we have noticed in terms of folks aging in place, of course, evictions due to, habitability as folks age, their ability to keep their units clean and sanitary declines, folks with behavioral health challenges due to substance use, in addition to other medical and mental health challenges can be compromising. Looking at like health conditions and how they happen over time, also knowing that, folks who have experienced homelessness typically are older than their actual age and also have way more complex care needs than the general population. And then the third thing was access to quality support services. So for folks who operate permanent supportive housing, you probably know this very well, that people think that, we're very well resourced in permanent supportive housing, and typically what that support is a case manager and not full wraparound services. So what we saw as gaps, just some, I think, basic things that people don't always understand is that, the VA does not provide everything for every veteran. So that, can be a challenge in terms of if you are the housing provider, service provider, the VA doesn't give you everything that you need for a veteran who's eligible for VA healthcare, not to mention for veterans who are not eligible to receive their care with the VA. And then also, veterans typically, if they are having a lot of challenges and they apply for VA service connection benefits and they are approved, their income, which is connected to their rating, is based on how acute their needs are. So for a veteran with quite a bit of disability income, it can tend to price them out of in-home support services through programs like Medicaid, just because their share of costs is very high. So that was also a barrier. And then also navigating all of these different services, agencies, that can be a complicating picture and difficult for most of us, and especially folks who are aging. So this gets us to the pilot. And so VSSR stands for Veteran Support to Self-Reliance. We did not come up with that title. That came from the state. It's not the best title, but this is what we had. And so this pilot is being administered by the California Department of Veterans Affairs, and it's happening statewide in California across 6 housing sites with different providers, the folks who are listed here. And then Swords to Plowshares, our policy department, is the TA provider for the program. And then we're working with RAND to do the impact evaluation. So, we have quite a number of veterans who are enrolled in this program thus far. When you get the PowerPoint, there'll be a QR code at the end if you want to read a little bit more about like first year findings from the pilot.
Thank you, Tramicia. I appreciated hearing a little more about VSSR. That's another alphabet soup mouthful. We'll dive into some questions. I'm really eager to hear from both of you. Gilly, we've collaborated on this topic before, and we've also worked with RAND. Can you help the organizations on the call think about what they should do before engaging with external organizations to do that program evaluation work? How would they know a good program evaluation effort and what it would look like?
Such a good question. So I'll mention the thing that I keep coming back to still is the most important thing, which is that you just absolutely need to know and have clarity on why your program exists. What problem are you trying to solve? How are you solving it? What does it look like if you've magically managed to solve it? If you've been operating for a while, it's okay to pause and revisit that. We've talked a lot about, there's a lot of evolving needs that this population has. So because you started something one way, it doesn't mean that that's still going to be the same need however many years later. So I think that thinking about that at any time is the number one thing that we would suggest. And if that's something that an organization is struggling with, then that's where the evaluator should start with you. So you can think about it as just any other good support, consulting type situation where you want the person to meet you where you are and really understand your organization and what you're doing. So to us, at least, a good program evaluator cares about your programs and who you're serving, has some cultural competency with that population and those types of activities, understands, what you are trying to accomplish, like what your needs are, and can help clarify that with you and get you further along in that evaluation readiness journey. So we have, you don't need to dive in with a bigger, like fancy third-party evaluation, but it doesn't mean that you wouldn't benefit from outside support. It can help to talk to someone outside because if that's what you're building toward, they can help you get started in a way that would make that more achievable in a certain amount of time. So for us, it's really, do they understand you and care about your work? Have the skills, obviously I'm taking that for that they have the right skill sets to support, but that they can meet you where you are and get you a little bit further on that journey. And and I will just say from our experience, we will always recommend starting with that program theory and design stage if that's something that your organization doesn't feel like you have in place in a really strong way, which you wouldn't be alone if that was you. Just
Okay.
say it.
Absolutely. Thank you. That's really helpful. Could you share more about logic models and measured outcomes, how those are helpful tools in the program evaluation process?
Yes. So, and I also was peeking and I saw that example of an output that's not an outcome. So I might try to like rope that into here too. So I think that those tools are the most helpful because they're just a way to keep everyone grounded and aligned, even if you can't measure everything right away. When we work on those things, I'll say, I won't speak for everyone on our team. When I work with people on those things, I like it to be very spaghetti on the wall, like every input, every activity, like there's no, like more is more, and then paring it down to the essentials. So it can be helpful to be like, what are all the resources we have? It's almost like asset-based thinking at the beginning of like, what are our inputs? What are we doing? And then saying to yourself, okay, what are the things that like I really need to measure? It helps you really get clear on if I can only measure a few things of this giant list of outputs, how, and an example of that would be number of people that attended the program, and number of people that completed the program. Whereas an outcome might be like your completion rate, because it would tell you, oh, I'm reaching the right, it's a really important, that's not a long-term an outcome, but it's certainly like a process outcome, like a short-term outcome of, am I reaching the right people at the right time for this program? And it's good enough that they're successful and can finish the program. So that might be something that we would recommend for anyone to understand about their program, especially if they're focused on quality. So I think it just helps you really filter out what's more important, what's less important, filter in what's important, out what's less important, and that can really inform your data collection choices when you have limited resources. So that's one way that it's really helpful. But it's not necessarily something that you have to keep up to date all the time, but it can be like really helpful program documentation as well. Something to visit, once a year and say, are we still doing these things? Are these things still matter? So those kinds of uses, I would say.
Absolutely, and multiple ways to benefit your organization. Tramicia, I would love for you to start off by sharing a bit more about Swords' work and how you've been able to really leverage your insights from program evaluation to improve your programs.
Yeah, absolutely. I mean, I think one of the things that Gilly had early in the presentation was looking at staffing that you have within the agency to kind of help with this work. So we have a staff member on our policy team who really has some really good background around program evaluation. And so that was instrumental for us in thinking about, how are we delivering services? What are some of the things that we need to be thinking about in terms of serving veterans? We did a broader kind of like large macro system view of our services a while back, and had a consultant come in and they did some work. We weren't necessarily satisfied with that with that outcome, and so this time around we were thinking about how to address the needs of aging veterans in our permanent supportive housing programs. We looked internally because it was a lot easier for us to work with staff who understood our system of care, what we do, how we do it, who we do it for. So we didn't have to spend a lot of time on that level of learning up front. And then also utilizing data from our, client management system and thinking about, what can we pull from there? What do we have coming in through surveys? What do we have in our property management data systems? That all of that can filter into just thinking about what are some of the gaps, what are some of the needs, how do we think about, addressing those things. And I think the other thing that I would say that sometimes we can leave out is things like focus groups. And so, we had staff, who were meeting with our policy team to really talk about what were some of the issues that they were seeing. Because oftentimes like things can get left out of surveys, or, people didn't think about this, or in a conversation, somebody sparks an idea and they're like, oh yeah, this thing. And so that was really instrumental as well. Just plain talking to people. And so I think, the combination of all of those things is really what we did. It's not easy. It takes a lot of staff time. And I think, as was mentioned earlier, you really have to have buy-in from the top for this to work, because, it's yet another thing on top of what people are tasked to do throughout the day. So it, takes time, but it's definitely worth it in the end to better serve your population.
Out of those changes that the program evaluation you're describing suggested, were there any that you said, no, we're not going to do that, and explain sort of your decision-making process there?
Yeah, I mean, I don't think there were things that we came away with, no, we're not going to do that thing. Because we've been doing, at least, thinking about this VSSR pilot, we've been operating permanent supportive housing for over 20 years. We've operated transitional and, other types of temporary housing, but we have been doing this work for some time. I think it was more of, we can't do everything, so how do
Right.
you weed out the things that are not,
Prioritizing.
yeah, prioritizing, and things that, while they may be helpful, won't be impactful. And so, like really trying to tease out where can we best spend the time, because, when you're doing something like a pilot, there is a lot of paperwork that comes along with that. And so you can measure a lot of things, but what's really going to get the bang for the buck at the end of the day and really tell the story of why, this thing that you are hoping will be successful should be funded at a larger level. And so I think, it wasn't so much of what, we didn't take the advice or, like didn't implement. It was more of what do we have the capacity to do?
I'm curious, beyond those formal evaluations, Gilly, you've touched on, and Tramicia, are there some simple practices or tools that those on the call can easily implement into their day-to-day to really strengthen program design and overall impact?
So I think that one of the things that I would suggest, this one thing I think is good for everyone, kind of, and it kind of gets at what Teresa was saying. It's like doing a little bit of like a data inventory. What are you collecting? When are you collecting it? And how you're collecting it? And then are you using it? Because actually you can stop collecting a lot of stuff. You heard it here first. Stop collecting so much data. I think that it can also going through that for real though, going through that exercise can tell you, well, is it not useful because I'm collecting it too early? Has not enough time passed for me to see an effect, if you're thinking about sort of like a post program survey. But also, like, do I really need all that demographic information? Is that too much of a burden for my participant? But like, what do I really need to know to be able to understand something by all the characteristics that I need to understand them by? So that's really helpful and not too, I think, wonky to try to do. It's just sort of doing a gut check on what you're collecting. That's one. I think that another is, this is probably less fun, but also can be not too hard, is just like doing a little bit of a scan for recent, like peer-reviewed studies and really reputable organizations, like evaluation reports, to things that are a little bit similar to yours. If you're trying to figure out what should I be measuring, like that's a good place to start. And you don't have to understand, I certainly don't always understand all the methods and all the stats inside of those papers. It's more like, what are the variables and the things that they're looking for by way of outcomes that you want to focus on in those, and making sure that the program that they're talking about is at least a little bit similar to yours. And again, not saying that's a perfect solution, but it's something you can definitely do on your own. And then the last thing I'll mention is what we were sort of getting at before around like needs changing. taking that step back also to say like, okay, we were really focused on this subset of the veteran population, but now, we know the veteran population is aging, and we want to focus on, do something that's a lot like what Swords to Plowshares, like focus on that sort of population of helping people age in place, whatever it is. Or no, we're really focused on post 9/11 veterans that are just getting out of the military. It's very prevention focused, whatever it is. Like really think about that problem you're solving and making sure that who you're reaching is that population. Because that's like an easy sort of thing to try to understand.
Thank you. That's helpful. Tramicia, anything you'd like to touch on that?
I think just to really emphasize what Gilly mentioned around looking at what you currently collect, because you may be collecting things that you don't think are useful in evaluating the work that you do, but it very much could be. So just an example, one part of what's being looked at through the pilot is information coming in from our front desk staff. So shift reports, things that have quite a lot of information of what's happening, in the building. So like that's data there that's not necessarily in our client management system because it's coming from a different source, but just thinking about where will you get the most useful information? And sometimes it's not the therapist, it's not, sometimes it's the peer. So
Right.
really thinking about what you collect. And Gilly, I don't know if you've talked to our IT director who reminds us constantly that uh, is this helpful information to start to add and collect and track? Are you going to overburden the veterans with asking all of these questions? What about the staff time? Now we have data quality things we need to think about. So, just really putting a fine point on, you don't over collect because that will not be helpful. You'll just have too much information. So, really thinking about where you could get the best information. And it may be from unlikely sources that you really haven't thought about, which is, sometimes why it's helpful to have a broad tent to get a sense of what the gaps are, what the needs are, and then going from there.
So I'm going to take that as not the like, how would one do a qualitative analysis with thematic coding and all of those types of things. But like, if you have a lot of open-ended responses where you're getting really rich information, one thing we've done with some of our own data, but also for organizations that we work with, it's okay to start out with like an open-ended comment field or like a, especially if you have a drop down and then you have that other and then people can put whatever. That if you just look at those things, sometimes that can help you take a question that's really open-ended and that your IT person might be like, oh my God, you have to have a character limit to this. It's taking up too much space, or like, are you even reading all these things? Like you do it for a little while and then you say like, we're seeing these 5 things over and over again. I'm going to change that to a drop down. And then all of a sudden it becomes much more concise, much more usable, and you sort of like quantified something that previously you just sort of anecdotally had been hearing. So like that's one other thing that we've done, and I think it can help minimize how much kind of that open-ended stuff that you've got to go through, because it does take a lot of time. It's really rich data, but it absolutely takes up so much time.
It can absolutely be a time suck, which we all, need ways to save time these days. Gilly, I wanted to touch on, I know IVMF will often conduct program evaluations for organizations across the country, but that can be cost prohibitive. Are there some cost-effective ways that you'd recommend our folks in the room today conducting a program evaluation could go about that?
So I think that aside from a couple of the things I mentioned with trying to find maybe university partners or student partners, or I saw some notes here in the Q&A about some of those things. I think for us, we originally had done not, enormous, some larger projects, but not necessarily really large scale studies. But we were finding so many organizations in that circumstance that you're describing, Deirdre, where it's like they're just starting, they're pretty small, they don't have a big budget. And so we did a little bit of market research, and we now are trying to offer more types of project work for people that are in that situation. And I suspect there are others that do this too, but I can just speak to how we've thought about it, which is if you might just be getting started and want to do that program theory and like that really like fundamental thing that can unlock lots of other measurement opportunities for you, like the program theory of change, if you want to call it that, but just like your purpose, all of those things, your logic model. Or maybe you feel really good about that and you've just been doing a survey and it just isn't giving you what you want, and you just want someone to look at one survey, and what your expected outcomes are. We've tried to start working on mini projects with people around some of those things that are much shorter term, a little more intensive, and then, that can be a building block to something else. So that sort of, or maybe you just want us to do that first little lit review to help you find the evidence base to tell you what the outcomes you might want to look for, like things like that. Lots of creativity around what those really small, like we were calling them micro projects, like what those might be. And then the other thing for people is like just talk, we're always happy to do this, and most evaluation, consultants I think would be just reaching out to talk about initial scoping. So like how can we help you prioritize? Like tell us what your budget is. I know that there's like a dance around like, well, how much does this cost? Well, how much do you have? But guess what? If you come to us and you're like, we have $5,000, that's all we have. We have 3,000, whatever it is. I'm not saying everything is going to cost that little, but I'm just saying it can be little, and say, what can we do? That's a really fair question to ask our team, for example, and we would love to try to figure out how to prioritize with you or help you think about what you could write into your next grant that would plan for evaluation should you receive the grant. And guess what? I don't know, maybe Deirdre and Hunter and others can corroborate this. I think that might make you a more competitive grant applicant if you have an evaluation plan built into your grant. Just saying. So we're happy to do things like that also. So I think it's really just if someone is like raising their hand and saying, I want to like measure better, I want to understand if I'm helping people, like we want to have that conversation and then try to do our best to like make a recommendation of where to start on the cheap, but also not on the cheap if you want to hire us for big things too, which we also do, should say.
Gilly, I think we just need to clone you, a couple Gillys around. Thank you. That's very generous and I think helpful advice for everyone. Looking at the time, I am surprised to see we only have 7-8 minutes left. And I wanted the opportunity, Tremisia, to discuss a bit more about the pilot program you've been involved in for the quality of life for aging veterans in permanent supportive housing. I'd love to hear a bit more about how Swords and those other participating organizations decided to embark upon the pilot, and how that program measurement and evaluation has been integrated into that work.
Sure. So the pilot started, I think we are in year 2 of a 3-year pilot. So we've been going for a little while. Of course, with any pilot, it takes a while to ramp up, get staffed up and all that. Again, with the slide deck that'll go out, there'll be a QR code to the legislative report just to share, a little bit more of the findings. But yeah, I mean, the pilot has been interesting. I mean, I think, when you think about like research or whatever, it's always said that you should not go into it with an expected outcome. But we are totally going into this pilot with an expected outcome of better outcomes for the veterans that, we collectively serve across the state. So, to date, we've actually had like really amazing outcomes. I mean, I think, a number of us have served veterans for years. So, we weren't new to being able to provide the appropriate types of care for veterans. The issue was being under-resourced to do so. So, we don't think we're doing anything like earth-shattering and groundbreaking, but we do think putting the support in supportive housing is what is making the difference, right? When you really fund these services that people need, you see people's quality of life get better. And so, in addition to, thinking about like what some of the gaps were in terms of talking to folks across the state. What's happening on the other end now that the pilots are active is a lot of data collection. So, there are a lot of, forms and assessments and all of those things that the various staff are having to fill out just to try to get a sense of what is helping, what's impactful. So, across the pilots, there was not a one size fits all in terms of staffing that people could hire. It was a menu of options. So if you, had social workers, but you needed peers, you could get funding for peers. If you wanted to contract out for occupational therapy services, that was also an option. So we really tried to think about what are the universe of gaps in terms of staffing that people could have, and how do people have the ability to kind of self-select what their program participants will need, and not just assign everyone gets these 5, positions and have at it. So I think that was also very helpful, which may also make it a little more complicated in terms of the impact evaluation to really see, what works, because it may not necessarily be an apples to apples comparison. So again, lots happening, really great outcomes to date. Folks are doing well, and next step, always the biggest step, is how do you get it funded permanently? So that's kind of where we are.
Noticing the time, I wanted to wrap up by asking each of you a final piece of advice to give organizations really looking to build that culture of evaluation and continuous improvement. What would you impart?
I think I would just say don't be afraid to start. I think that's, our kind of thing, and don't be afraid of what you may get back. So, just it's always helpful to self-evaluate and think about if what you are doing is really having the intended impact on the people that you serve. Because, I'm assuming most of us are mission-driven operators, and so you always want to make sure that your services are needed, and that they are providing, what you intend to provide. So I think that would be the thing I would say, is don't be afraid to get started, no matter how small it is. Any step forward is a good one.
I love that, and agree. And I think that it helps when you have a senior leader that believes that. And I think I thought about this a little bit and talked with a colleague that sometimes the culture required to do continuous improvement and quality is a little bit different than building a culture around impact evaluation or outcome evaluation. Not saying that their intention there, if you have kind of all the ingredients, you can do both. But especially if you're just getting started and kind of just like doing what you can and not being afraid to get started, that I think that type of culture just requires a lot of humility around the process and being patient and willing to make changes and not necessarily have everything go great, or like that type of iteration is actually really, to Teresia's early point about the impact evaluation, it makes impact evaluation hard when you're making a lot of program changes. So I think building that understanding of your process and all of those things first is really creates a really good good culture around that quality and measurement. And then asking yourself, okay, now I think we've like worked out some of the kinks around these things. I think we know enough about what we're doing. Then shifting to how effective is this, and compared to something else, or how much impact am I having? That requires a lot of humility at the senior leadership level, even more so, I think, because it is you have to be brave. You have to be willing to see what's working and what's not working. And and last thing I'll say for us is like, if you are, it is a plug for doing some of this internally or with an evaluator that understands that you're in a learning mode, so that not everything you learn has to be shared right away. That's okay too. It can be just for you to figure out how to tell your story and like what is working.
I like that reminder of keeping humility top of mind, and it can be painful at times, but keeping that ultimate goal in mind. Big thank you to both of you, Tremisia and Gilly, for your time today and sharing your experience. I know that it's been really helpful for our partners on the call, who I also thanks. I know that you have extremely busy schedules, so jumping on today to learn with us has been terrific. In the coming weeks, we'll be sharing an email with the link to the recording. And we encourage you to share it with your networks. You know, if you have a teammate that wasn't able to join us today, please pass it on. And again, just a big thank you. And I hope everyone enjoys the rest of their afternoon.